Hey, Calgary, I'm Kevin Choney. Thanks for joining us tonight. This evening, we're talking about, well, seasonal affective disorder, and I'm joined by Sara Jungen, as well as Dr. Scott Patton. Maybe I'll start with you, Scott. Tell me a little bit about yourself, your field of study. I know you're heavily involved with, well, a lot of research, sad. A bit about yourself, if you would.
I'm a psychiatrist at the University of Calgary, and my academic discipline is epidemiology.
Sara, yourself, you're a registered psychologist. A bit about yourself and your practice, if you would.
Yeah, so I operate a private practice called Menla Psychological Counseling, where my associate and I provide counseling mostly for concerns such as depression, anxiety, relationship difficulties, those sorts of things. And we specialize in mindfulness-based approaches and trauma therapy.
Mindfulness-based approaches.
Yeah.
Cool. I want to touch a little bit more about that as we get into our discussion here. Let's start with that, though. I mean, like many other Calgarians, I loathe the winter. I mean, the winter's no fun, right? I can't help but think I probably likely suffer from the winter blues. But where do we draw the line from, suffering from the winter blues into full-blown seasonal affective disorder? What are the symptoms?
Yeah, so winter blues and seasonal affective disorder, they'd sort of be on a spectrum, on a continuum, with seasonal affective disorder being a much more severe form of winter blues.
Okay.
And so some of the symptoms are things like reduced energy, being pretty lethargic,
Yeah.
Sleep disruptions, so needing much more sleep, yet not feeling rested from it and having a hard time getting up. Changes in appetite, such
Okay.
as often craving carbohydrates, things like cookies and pastas and breads, those sorts of things. Another thing is changes or difficulties with cognitive functioning, so perhaps memory is not as strong. Yeah, those sorts of things. In really serious cases, it can also include thoughts of suicide.
Wow. Okay. So then, Scott, how does the seasonal affective disorder diagnoses differ from traditional clinical depression?
Well, in the official diagnostic nomenclature that's in use now in psychiatry, it doesn't differ in terms of its presentation.
Okay.
It still has to fall within the scope of what one would be willing to call a mental disorder. That means there has to be a syndrome consisting of signs and symptoms, as Sara's just described.
Okay. I want to talk a bit about light therapy. One of the popular it's definitely heavily marketed, this light therapy, which for those who don't know is essentially people would sit in front of a lamp, and I guess these lamps would mimic the UV produced by the sun, and the idea is that by absorbing that UV, you're going to generate the vitamin D and potential serotonin, then that's going to help you deal with your seasonal affective disorder. Now, I don't know. I've read the internet a little bit. There's kind of two sides to the coin. What do you think, Sara? Is this legitimate, or is this a pseudoscience? These light?
I would say that it's legitimate.
Yeah.
From my understanding,
Okay.
there's good scientific research backing it up, and as Scott was saying, it's since about the 1980s that this has been researched. So there's a lot of years of good evidence, and there's been studies done where it has a comparable effect to antidepressants such as Prozac, but with
Wow.
light therapy it actually kicked in. It worked more quickly.
Is that so?
Sometimes
Interesting.
results can be seen within 2 or 4 days of starting it.
2 or 4 days?
Yeah.
That's incredible.
Uh-huh.
You're of the same opinion then, Scott?
Yes, according to
Okay.
our Canadian guidelines, this is a first-line treatment,
Yeah.
meaning that's a reasonable first treatment if you
accept
have
it's standard,
seasonal.
safe to say?
Yeah.
Okay.
Yeah, that would be for mild to moderate depression.
Yeah.
That would be a legitimate first choice for treatment. I would say also, if you look online and you're looking at different lights, there are a number of inexpensive ones that only deliver 5,000 lux. And there's some debate about whether that intensity is enough. It really should be 10,000
It
lux.
kind of begs the question, why are these products on the market? I mean, it's probably just a lack of people, or I guess a governing body policing. But this is tough because people are suffering and they think they're helping themselves. Their doctor might tell them, go out and get a lamp and 5,000 bucks, what's the point type thing.
Yes, indeed. The way they're regulated, it's up to the consumer to be careful about the specs of what they purchase.
And hopefully a doctor making a diagnosis will be particular about it needing 10,000 lux.
Is it fair to say that most doctors are educated when it comes to equipment like this, do you think?
I would hope so, and just at least in that basic prescription that it needs to be 10,000 lux. If you keep that in mind, that's already a really good starting point.
Yeah, I guess just read the fine print, right? Like anything else. So what are some of the more traditional treatment options for SAD? We talked about the lamps. Obviously, I guess the psychotherapy would be one.
Yeah.
I would think of pharmaceuticals. Is that fair to say? Am I missing anything there, or is that kind of the gamut?
In broad strokes, those would be 3 categories of mainstream treatments. Now, physical exercise was also mentioned.
Sure.
Which is a legitimate treatment option for mild to moderate depression. There's also several forms of evidence-based psychotherapy, as well as many different types of medications that are used.
Sara, tell me a bit about your practice. So somebody comes in, they're, I guess, concerned they're suffering from SAD.
Yeah.
You've taken a contemplative psychotherapy approach to things. Your full, I guess, gamut of treatment. If I'm coming in the door, how are you going to treat me?
Well, so in terms of positive psychotherapy, therapeutic interventions, the main one would be CBT. And what that entails is sort of examining the content of your thoughts. So for example, having the person identify problematic thoughts, such as like, I'm a failure for not completing my project on time, and then finding evidence that supports that, and maybe evidence against that, and then seeing if you can come to a different conclusion.
So that's a CBT.
Yeah,
okay.
And then if you incorporate a little bit of more of the mindfulness, you would also have the person examine, when they hold that first belief, I'm a failure, what is that like in their body? There's probably a sense of weight, of hopelessness, and then when you shift and find a more positive belief, the person might feel a little bit more confidence, a little bit lighter. So just also incorporating a bit more of the body is when you incorporate the mindfulness.
Is there any room for, I know, a bit of a layman, meditation, some kind of almost alternative therapies?
Yeah, absolutely. There's really good research showing that mindfulness-based therapies are really good for depression. So basically mindfulness is becoming aware of what's happening in the present moment, so kind of the opposite of autopilot, where you're just going through life.
Which so many of us do so frequently, of course, yeah.
Right, and then in mindfulness therapy, you start to change your relationship to thoughts. You start to watch them, so you develop an observer, and so at some point you start to recognize that the thoughts are not only, you're capable of thinking anything. There's thoughts come and go constantly, and you just keep trying to focus on the breath. And once you start to shift your relationship to thoughts, when you have a thought such as, this is hopeless, I'm never going to feel better, you don't necessarily have to believe that. There's a mindfulness slogan that says, don't believe everything you think.
I like that, yeah.
Yeah.
Yeah. Does this mean that you're, as a psychiatrist, obviously, are you more prone towards pharmaceuticals, or do you sort of respect and appreciate, and maybe in practice, a little bit about, or a little bit what Sara would bring to her patients as well?
Yeah, both of those modalities, classical cognitive behavioral therapy and mindfulness-based therapy, are both considered first-line options for depression.
Final question: if somebody believes that they may be suffering from seasonal affective disorder, what's your one piece of advice that you would give them? Maybe Sara, I'll start with you.
I think that if it is significantly impacting their life, it's important to get professional help, not just to go online and to get a mood lamp.
Don't self-diagnose, it sounds like.
Yeah. If it's just a bit of winter blues, just feeling down, it might be okay to get more sunlight and get a sun lamp. But if it's markedly impacting your life, and absolutely if there's any suicidal thoughts, to go see your doctor or a registered psychologist.
Strong advice. I imagine you would probably mirror just that, Scott.
I would certainly agree with that. There's still a stigmatization related to these conditions, so one of the things that keeps people from seeking help is sort of a sense of shame, that it's a sign of weakness.
Really unfortunate.
Something, it's terrible. Destructive that's not the way you want to be thinking about this. This is a health issue, a manageable one.
Yeah.
Get the help you need.
Absolutely. Excellent, guys. Very much appreciate you being here tonight. Thanks.
My pleasure.
Thanks for having me.
Folks, that's all our time for this evening.